My name is Laura Ramirez, and I will be discussing antibiotic overuse and resistance. To start off, what are antibiotics? Well, they were developed by Alexander Fleming in 1928. They are used to kill or inhibit the growth of bacteria. They are used in the treatment of bacterial infections. They are either classified as broad spectrum or narrow spectrum. Broad-spectrum antibiotics are used to treat several types of antibiotic infections, and narrow-spectrum are used to treat a specific type of infection. So how do antibiotics work? Well, they prevent the bacterial reproduction of their DNA or by inhibiting and killing the bacteria. Antibiotics have transformed the way bacterial infections were treated and revolutionized medicine. After covering some basics, we'll go over antibiotic overuse, which is taking antibiotics when it's not necessary. And some examples of this are excessive prescribing by doctors when there is an infection, but they're not really sure if it's bacterial or if it's viral. And in taking antibiotics for viral infections, such as for a cold or for the flu, in self-medicating, and increased intake of antibiotics in livestock. The overuse of antibiotics has created bacteria that have evolved in ways that their genetic material can resist antibiotics. So the overuse of antibiotics has led to the antibiotic resistance. For that reason, we have seen a rise in antibiotic-resistant infections. Antibiotics have become ineffective in treating certain types of infections due to change in bacteria. In addition, the lack of development of new antibiotics has added to the problem. Some of the bacterial infections, such as Staphylococcus aureus and Mycobacterium tuberculosis, are easily treated with antibiotics. However, there are strains of these bacteria, such as methicillin-resistant Staphylococcus aureus and drug-resistant Mycobacterium tuberculosis, which have evolved a resistance to antibiotic treatments. For instance, methicillin-resistant Staphylococcus aureus, also known as MRSA, is a very serious bacterial infection. It is one of the most common antibiotic-resistant infections to present date. Per year, there are 80,461 infections and 11,285 deaths per year reported from the CDC. The most common places of infection are inpatient care facilities or hospital settings. However, in most recent times, there have been some cases of MRSA in the community setting. However, it is not as common as the infections in inpatient care facilities or hospital settings. So MRSA presents itself as a skin type infection and is similar to spider bite, and it appears as bumps. And symptoms of this are redness, swelling, pain, warm to touch, pus or drainage, and fever. The treatment for methicillin-resistant Staphylococcus aureus is limited. It is usually approached by treating the affected area by creating an incision and draining the pus and fluid. And this is followed by treatment with a mixture of several antibiotics, such as trimethoprim, sulfamethoxazole, doxycycline, mincycline, clindamycin, rifampin, and linezolid. And this course of antibiotics is followed for a 7 to 10 day period. Drug-resistant Mycobacterium tuberculosis is a strain of Mycobacterium tuberculosis, which is the most common type of bacterial infection and is actually easily treated with antibiotics. However, DRTB is resistant to rifampicin and isoniazid. And out of the 10,528 TB infections, 1,042 are DRTB. And there are estimated 50 deaths per year of DRTB. And people infected with DRTB are usually those who have been born outside of the United States. The symptoms of DRTB are actually no different from regular TB, which are cough with thick sputum, bloody mucus, fevers, chills, night sweats, fatigue, and muscle weakness, weight loss, shortness of breath, and chest pain. And to identify if the TB is drug resistant or not, the patient's sputum has to be collected and it has to be tested to see if it's drug resistant. Like with MRSA, DRTB is not always effective, and this is due to the short supply or the lack of new antibiotics being developed. One of the first steps in treating DRTB is to isolate the infected individual from the population to prevent further infection. And one of the treatments that is used is fluoroquinolone antibacterial drugs, which can be highly causes a lot of side effects, and it's highly dangerous. Another sector that is known for their active use of antibiotics is the agricultural sector. I don't know if everyone knows this, but 80% of antibiotics produced in the US is used on livestock, and the antibiotics are used to prevent infection, promote growth, and health of the livestock. So some of the known problems with the overuse of antibiotics in livestock is that the antibiotics used in livestock actually contribute to the antibiotic resistance in humans, and this is due through ingestion of animal products, which in turn creates health problems in humans. However, humans are not the only ones affected by the antibiotic overuse. There's been a problem with microbiomes being affected because there's been some changes in the ecological niches because they are now vulnerable to microorganisms with growth inhibitor factors. Recently, Helicobacter pylori has been in the news. This is an enterobacteria usually found in the digestive tract of humans, and it causes common infections, which are something like ulcers. It is found in about 2/3 of our population, and in recent news, Helicobacter pylori has become a high priority to the World Health Organization because of its increased rate of antibiotic resistance. So they have ranked it as a high priority because of the way it's evolving into a danger to the human health. So all things considered, the overuse of antibiotics and the resistance of antibiotics is not only a problem in the US, it's a worldwide problem. Government interference is required to implement policies and to monitor the use of antibiotics and the production of antibiotics. We need to create new initiatives to combat and prevent the overuse of antibiotics, because if we want to have these type of treatments in the future for future generations to use, we need to come up with something to salvage the antibiotics and to find a way to treat drug-resistant bacteria.